This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is Medtalk, your weekly on-air health consultation here on the Solar News Channel. Studies show that 80% of the knowledge that we acquire is through our sense of sight. Given this fact, our eyes are one of the most essential parts of our body. Unfortunately, it's also one of the most neglected. A staggering statistic shows that 135 million people worldwide have poor vision. The numbers are expected to double by the year 2030. In 2006, the World Health Organization estimated that 314 million people around the world are visually impaired due to eye disease like cataract and refractive errors. One of them is Miss Sonia Rocco.
I've been wearing reading glasses, because I was nearsighted, and since I was in second year high school. Well, I've read about, and I've talked to people who've had their eyes operated on, and ever since they've not been wearing glasses. So that gave me courage, and I scheduled myself. Well, of course, he had to do a thorough checkup, and I was qualified. And ever since then, maybe 3 years ago, I've not been wearing glasses anymore, and what a relief. After that, I even went scuba diving with my eyes, with these lenses that he put on.
Cataract, or the clouding of the natural lens in the eyes, is responsible for 80% of blindness. Statistics show that 70% of people over the age of 75 develop cataract. Errors of refraction accounted for 18% of visual disability next to cataract. These are optical imperfections that prevent the eye from properly focusing, causing blurred vision. Refractive errors are myopia or nearsightedness, hyperopia or farsightedness, astigmatism or the condition when the cornea appears to be oval-shaped, and presbyopia, which leads to difficulty in reading or seeing at arm's length. The studies show these eye conditions are alarming. How can we protect our own eyes from these problems? We see the world through our eyes. Hence, our sense of sight is actually considered the most precious and most complex of the senses. In tonight's episode, we will discuss the most common eye problems in the Philippines, how to protect our vision, as well as the misconceptions we have concerning our eyesight. Joining us is Dr. Carlos Chua, ophthalmologist from the St. Luke's Medical Center and Our Lady of Lourdes Hospital. Also with us is Dr. Noel Laksamana, ophthalmologist from the International Eye Center. You can participate in our discussion by calling our hotline, following us on Twitter and Facebook, and by emailing us. Now let's start our discussion. Hi, doctors. Welcome to the show.
Good evening.
Good evening.
You know, we sometimes fail to see the importance of our eyesight. Why do you think individuals tend to take this for granted?
Because if they don't feel anything, they don't complain.
Yeah.
For as long as they're okay.
Yeah, we have two eyes. So, pag-isipan natin, kung malinaw ang isa, yung isa hindi, kahit na malabo yung isa, we actually see better with one eye. So, they'll never notice a problem until that good eye suddenly gets blurry as well. And as long as we can function well, like Dr. Laksamana was saying, we can use our computer, hindi naman natin kailangan tumingin sa malayo. Kung malinaw, malinaw yon. Pero the moment they realize na, teka, bakit hindi ako makadrive, hindi ko makita yung placard sa malayo, then that becomes the problem. And that's when they start coming to us. But sometimes it's, a little too late for some of them already.
Or sometimes they've been, one eye has been bad for the longest time. They only notice it's not seeing when something happens to the other eye. When the good eye, say, gets hurt or there's foreign body, then they patch it. Then suddenly they can see anything. Then that's the only time they discover something's wrong with that eye.
Oh, and it's the only time they go seek the help of the ophthalmologist.
So kids, that's why we usually advise kids before they enter school
is to screen.
have their eyes checked.
We're talking about kids and your advice before they enter school. At what age should their eyes be checked? Should the parents bring them
depends,
to you?
like I always say, if your child is born full term without any problems, we can actually see them once, maybe at a year old, if there's any problems you see. If there's not, and you're fairly comfortable with it, then we can see them at 3 years old at least, and then another one is at 6 before school, just to make sure that they are seeing well. Because a lot of times I get kids coming into my clinic, and they come from their pedia saying, Doc, pinadala kami sa pedia kasi magulo daw, baka daw may problema. But the only problem, the reason they're not listening to the teacher or they're not paying attention is because they don't see as well as they're supposed to. So ideally, the recommendations is before school starts, at about 6 years, 5 or 6 years of age, then you get your first exam, just to make sure that they're okay. If there's no problems, then maybe 2 years later we'll do the next one. But if there's a problem, it depends. Kung nearsighted ka, then at least every year. Kung farsighted ka, ganun din. So, yung kinatatakutan nila, the people were saying, Doc, baka naman if I give them glasses, masama. It really depends. If a low amount of grade, let's say -1 lang siya, ganun, it's better pa rin to put it on because they don't get the eye strain, hindi sumasakit yung ulo, right? And depending on the kind of refractive error that they have, they can either outgrow their glasses kung farsighted kayo, or they can actually have to wear the glasses forever kung nearsighted kayo.
Okay. So it's also very important na, you take note of all these little changes na meron yung mga bata mo, especially when they start to watch TV
or observe them,
computer.
observe their behavior. If they're playing with their iPads and they're playing this way, something's wrong. Now, if they tend to squint whenever they watch TV or they come too close to the TV set, then again,
there is also something wrong.
There's
We're
something
talking
wrong.
about children. Let's go to the adults.
Yes.
What are the most common eye problems here in the Philippines?
It's still cataract
Cataract.
and errors of
And
refraction.
error of refraction.
What causes cataract and error of refraction?
The most common would be aging. There are other factors that would lead to cataract formation for, say, teens and early adults. Intake of steroids, if they abuse steroids, too much sun exposure. Then diseases like diabetes, it can lead to early cataract formation. But the most common type we see is the adult or the term used to be senile cataract. But nowadays you don't use the term senile because the patients, they get offended. So we just call it cataracts or...
Yeah, so it's usually, if you think about it, when you hit 60, there's about a 33% chance that you'll start developing a cataract. By 70, that's about 66. By 80, almost all of us will have a cataract already. But just because you have a cataract doesn't mean we have to remove it right away also. It also depends naman, no? So we both have, Dr. Naksaman and I, all the doctors will have a guideline on where we tell you, sige, pwede na natin tanggalin, at saka meron naman yung, let's just wait a little bit, we can just wear glasses. If you see 20/20 with a pair of glasses, even if you have a cataract, we can opt to wait a little bit, right? But it really depends too. And it also, like Dr. Laksamana was saying, if you're diabetic, control of your blood sugar is the most important. We have the juvenile diabetics, as we call it, na ever since they're young, like say 15, 16, they're diabetic. I have to do surgery on them by the time they're 24, 25, because the cataracts are really bad, because matigas ang ulo, they don't follow, they don't have to put their medicines, they don't have to take their insulin,
or wear their glasses for that matter.
Yeah, wear their glasses. But then, of course, the glasses don't cause the cataract.
Even with or without the glasses, cataracts will happen. Glasses won't stop, or glasses won't cause cataracts.
Can you describe to us what cataract
can we
actually
show-
looks like? Or maybe you brought some
here.
pictures here. And
If this were the human eye, we cut it cross-section. There's this part of the eye we call the lens. The lens is naturally clear. So as time goes by, the lens fibers are continuously produced, and they just get compacted in that area, bounded by the lens capsule. By age 40, you start having difficulty reading at near. It's called presbyopia. That's why.
Yes, you go like that.
Yeah, you go like that.
Yes.
By age around past 50s, 60s, these lens fibers, they get so compacted, then suddenly they lose the regular arrangement. That's the time you start having cataracts here. Any factor that would cause irregularity in the arrangement of the lens fibers would cause a loss of clarity or opacification. Then any opacification in the lens is called cataract. So, but you know, nowadays cataract is not a big problem anymore. You know why? It's not so difficult to remove. It takes only about 7 minutes to take it off, then replace it with a new lens, a man-made lens that's implanted here. And okay na.
Wow. So no fear anymore na matatagalan, there's downtime. As you said,
And
7 minutes.
Yes,
and
7 minutes,
okay.
and we can do it with patients awake. Anesthesia is just topical.
drop.
You just drop the anesthetic. From where we trained, St. Luke's.
It's very
That's
fast.
how you
that's
do
how we do it.
That's how fast we do it.
But now my practice is mainly in the province at the International Eye Center. That's how we do it.
Okay.
And we can do so much in so little time.
That's nice to hear.
Yeah.
We will go back to this topic, but we have a tweet from Romel David. He asks, does wearing eyeglasses give hope that my vision will be corrected? I don't want to get too dependent on them.
Wearing eyeglasses won't correct your vision. If you take them off, correction disappears. Your correction only happens while you're wearing them. If you want to get rid of your eyeglasses, I think you may undergo laser eye correction. Or if your grade is quite high, just like the case of Mrs. Sonia Rocco,
Yes.
you may undergo refractive surgery. We do a lot of that. Say if your grade is about 800 or more, and you're not amenable to laser eye correction, we do lens replacement. In my practice, we do a lot. We do at least 3 or 4 every week, more than 1,000. Yeah.
Wow. So if they don't want to have
To do the laser.
The
So
laser.
nowadays we have good lenses that would allow the patients to see near, far, and everything in between.
You know, so much is happening in the field of ophthalmology, no? And a lot of people who have had concerns about their eyes now have a lot of choices. They don't have to bear or ika nga titiisin nila na hindi sila makakita because they have no choice. But when we come back, we will talk about the misconceptions we have concerning our eyes. You're watching Medtalk on the Solar News Channel. The eye is only one part of the human body that can function at 100% ability at any moment, day or night. Carrie Di Maculangan has been suffering from blurry vision ever since she was a child. Thinking that it was just normal, she struggled with the problem until she decided to get glasses when she was in high school. Wanting to do away with her eyeglasses, being nearsighted and reaching an eye grade of 375 to 450, she decided to undergo treatment called PRK or photorefractive keratonic surgery.
Before ako mag-undergo dito, sabi ng doktora ko, kailangan ko mag-drop. So baka siguro, pwede nating parang pwede tayong mag-undergo ng LASIK. But eventually, chinek ulit yung mata ko, ang nangyari, ganun pa rin. Even sabihin mo na guarantee talaga sila. Pero syempre, nandun pa rin yung kaba.
A surgery that is advised for patients with a thin cornea, just like Carol's. The surgery aims to remove the upper layer of the cornea, then uses laser to correct errors of refraction like myopia. With the use of this technology, she is expected to see things better after 4 to 5 days without her glasses and contact lenses. Another treatment for one suffering from errors of refraction and high eye grade is the LASIK treatment, only made better because of the use of femtosecond laser.
Femtosecond is actually the speed at which the laser fires. It is 1 times 10 to the minus 15 per second, or 1 quadrillionth of a second yung rate at which the laser fires. No? With that rate, the flap is created in about 6 seconds. Then the flap is lifted, the grade is removed underneath. So now with this all-laser LASIK procedure, in a few minutes, the grade of one eye can be removed, maybe in a matter of 5 to 6 minutes per eye. There is another platform, in femtosecond laser for cataract, and that is the LensX machine. It's that precise, so it's literally like a drag and drop type of technique. The eye comes out on a computer monitor, we measure incisions, we can pre-slice the cataract like a pizza pie. No? And because of the accuracy of 0.001 millimeter, we know exactly how deeply we're going. There's no guesswork.
With the advent of advanced eye surgery technology, patients with eye conditions can now see the world clearly, brightly, and beautifully, just like Carol. We're back here on Medtalk, still talking about our sense of sight. Just as you saw in the VTR, Carol suffers from nearsightedness. And joining us tonight is Carol de Maculangan. Hi, Carol.
Hi po.
Kumusta?
Ayos naman.
Kakatapos lang nung PRK mo,
Yes, last Friday lang.
no? Kumusta anong pakiramdam mo ngayon?
Okay na siya, malinaw na siya.
Ba't dati, gaano ba kalabo?
Sobra. Parang pag inalis mo yung asalamin mo, parang saglit lang, asan lupalop ka ako naman. Kasi it's very, very blurred na.
Oo. Ano yung grade ng mata mo bago
Sa
ng
left,
surgery?
375. Sa right, nasa 452, 475. So, ganun siya kalabo.
Ano yun, pamilya mo, nagsasalamin din or ganun kataas?
Hindi, nanay ko, tatay ko, hindi naman. Pero yung mga kapatid ko, medyo mababa. Sa akin lang talaga yung bongga.
Oh, so in this case, ano,
It's not a
it's
genetic.
not
It's
genetic.
not genetics. There are myopia, especially has a genetic factor included in that. You know, if one of your parents had glasses by the time they were in grade school, there's like a 33% chance that you'll have one kid at least with nearsightedness. If both of them have, then it becomes a little higher as well. If you were premature when you were young, we call retinopathy of prematurity, and then you had some treatments as well, then you can also be nearsighted. But like, just be, sunerte lang na you
Sobra na
have it.
sinerte.
Although
Okay.
I see a lot of families with 3 or 4 kids na lahat sila high myo. So genes has a lot of role to play kasi errors of refraction is governed by the anatomy of the eye. And the anatomy of the eye is governed by genes. Yung configuration ng mata would depend on the genes na nanggagaling sa parents. This is one reason why Asians, ang daming ating myopics, mga Asians, ano? And most of the cases na I do na mga Caucasians, they're on the hyperope sides. So, in fact, my eldest na ginawa ng laser eye correction, I did surface ablation, which is PRK, 76 years old na Australian. Wala siyang cataract and hyperope siya, 500 ang grade niya. We did it, then he came back a few days later and he's very happy. Could read again, you can see 20/20. So,
Ano yung nagagawa mo na ngayon or gaano nakalinaw ang nakikita mo ngayon as compared to yung dati?
Before kasi, pag wala akong salamin, yung mga ganyan mga letter, hindi ko na siya makita. So, yung nagpa-PRK nga ako, Siguro nung first day, ano pa siya eh, yung masakit pa siya, tapos nasisilaw ka pa. Tapos parang meron pang
Sands.
foreign substance, kaganong-ganong ka pa. So ngayon, after 4 days, medyo okay na siya.
Ano yung
Hindi pa na siya-
nagpa-convince sa'yo na magpa-PRK? Tsaka, gaano katagal mo pinagdesisyonan?
Actually, hindi ko kasi masyadong, binabaliwala ko lang kasi may salamin naman. Contact lens pa, mga fashion pa yan din.
Nakakatulong ba yung fashion na yan dun sa case niya?
Attention seeker.
Okay.
Yun.
Siyempre kasi uso, di ba?
Uso kasi ngayon, lalo na ngayon, may mga kulay-kulay na
Yeah.
yun.
So nagaganon ka in spite of... Pero may grade
No,
yun.
but those are the grade.
May grade
May grade
naman.
naman yun. Iba lang yung
Bali
kulay.
yung friend ko na bumalik galing nga. Dito siya, nagbakasyon siya dito, tapos nagpa-laser nga siya. Tapos yung pagbalik, sabi mo, galing, ang ganda ka real. Tingnan mo, linaw-linaw. Sabi ko, o yung kita ko, gusto ko din. Tapos yun nga, after nun, nagpa-PRK din ako. Kasi,
So for us, like when we do the laser, we usually ask a patient before we lay them down in the bed for the laser is, we ask them, tingnan mo yung relo, nakikita mo, hindi. Tapos pagkatapos ng laser, which takes about 30, 60 seconds, right? When you look up, pagkatapos pagtanggal ng drape, tingnan mo anong oras na. Tapos at least yon makikita nila right away that, hey, I can see the clock. And for me, that's the biggest improvement. So I will have couples that will joke me after a procedure, Doc, ngayon ko lang nakita na gwapo pala yung asawa ko. Kasi dati,
Or the other way
Or
around.
the
Or the other way around.
right? So I don't have to wake up in the morning and try to look for
or
wear my glasses or squint, no?
And that's
the main
very
reason.
important.
Yeah. But then not everybody can also do the laser. I mean, case in point, I don't wear I still wear glasses because, it depends also on the curvature of your cornea or the foundation of your eyes. Ngayon, we laser the cornea, we surface ablate the cornea just to get rid of the grade, to reshape the cornea. Now, the cornea has to have a certain thickness. So when we think about it, it's like the foundation of a house. So if we live in a sandy bottom, we can only make a bungalow, right? Whereas if you have a granite bottom, at least we can make a 2, 3, 4, 5-story house. So it also depends. Yung mga matataas yung grade, let's say about 600,
Like Karen-
well,
Karen's
Karen's case is about mid, so that's more or less still okay. But let's say it's higher, 600, 800 to that extent. Now, the corneas can be very thin. Now,
We have a minimum, we call it
a minimum amount.
RCT, called residual corneal thickness.
thickness of
Yeah.
the cornea.
Because when a patient, for example, is myopic, this part of the eye, the front part, the central part is quite steep. It's steep. So you want to flatten that. So we flatten this using the laser beams. That laser beam, there's so many types of lasers used in ophthalmology. The ones used for refractive surgery or laser eye correction is called excimer laser. So it's when it hits tissues, the tissues get vaporized. Tissues are converted from solid to gas. Now there are other lasers. We have the YAG laser, wherein these lasers would cut tissues. They are called photodisruptors. When it hit a tissue, it would just break it up.
We'll talk about the advanced technology. I don't mean to cut you there, doctor, but we'll talk about the advanced technology when it comes to correcting our vision. But before that, we have another tweet from Sheila Tagaro. She asks, doctors, is it true that sleeping with contact lenses can cause blurry vision or can lead to blindness? Ikaw ba, Karel, natutulog ka na kasama yung colored contacts?
Yun ang
but-
masama. Kasi may nangyari na akala dyan, naalis niya yung contact lens niya, yung pala, nandun na.
Nakatulog.
Actually, I'm a doctor who discourage contact lens wear here in the Philippines. You know why? I see a lot of people coming in with corneal ulcers simply because contact lens overwear, contact lens. Some people are not so responsible. They don't wash their hands before they put on the lenses, so they develop corneal ulcers, which can lead to permanent blurring.
Or they're too tired to
Or
take
too
it
lazy.
off.
Too
Or
lazy, not
Oops.
tired, but just too lazy.
Sana tired na lang, lazy.
No, because when you sleep with your contacts, you dry up your contacts as well. And then, of course, you wake up in the morning, you're freaking out, and you're trying to peel it off. And then, of course, you get your abrasion, and then that abrasion can get more infections later on.
Yes.
And also with the contact lens, especially here, it's very humid as well. So the ulcers are more, we're more susceptible.
Susceptible
Yeah, we're more
to that.
susceptible to ulcers here as well.
Aside from our tweet, we have a Facebook question, Dr. Scarlett. Ariane Jerez. I did not have eye problems before, but in recent years, I was diagnosed with astigmatism. What could be the possible cause of this?
It's again, it's anatomic. When you have the normal eye should, sorry, I'll take it. This part of the eye, which we call the cornea, should be spherical. It's like cutting the basketball in half and sphere, no? People with astigmatism, instead of being shaped like a basketball, it's shaped like a football. So it's the curvature from one meridian is different. From north to south, the curvature is different and compared to the east to west dimension of the eye.
Yes.
So that's astigmatism. Now there are several types of astigmatism, and some of them are very bothersome, like the against the rule astigmatism. It's like putting your football standing up. Then you have the oblique astigmatism. These are the most notorious types that would lead to headaches. And,
Basically,
To distinguish, no?
yeah, so with astigmatism, especially if they're a low amount, I see a lot of kids with astigmatism. As long as it's a low amount, 25,
No problem.
50, 75, that's no problem whatsoever. But with kids, sometimes that's 75, since they're developing their vision, if they don't know, parang si Carol noong una, hindi ko alam na malabo pala yung mata ko. So as long as hindi nila malaman kasi, then they'll not mind it. Tapos, when they start studying, they're reading a lot more, sumasakit ang ulo. Pag nasa kotse, umaalo, gumagalaw. Kasi yung astigmatism, pag-isipan mo, instead of having your light going straight into your eye, it kind of goes off at a little angle. So that's why when you look at your kids, when you're watching TV, when they're watching TV, if they're looking at the side like this most of the time, Dok, ba't ganon sila manood? Or Dok, ba't ganon sila manood? Think of it as astigmatism. So it's a crease. I have a smooth shirt, there's a crease. Think of that as the light going at a different angle.
Kaya kinakailangan na i-adjust yung vision, no? Tingnan natin if our caller has the same problem or she may have a different problem. Hi, Mira.
Hi, Angel. I
You have a question for our doctors. Please go ahead.
I had my eyes checked and I found out that my left eye has a grade of 200 and 175 on the right. Lens and frame are quite expensive. Is it okay to use over-the-counter eyeglasses, just like the ones sold in the department store?
Okay. All right. Thank you. Thank you for your question. Doctors, medyo mataas ang kanyang eye grade, 175 and
Nearsighted
200.
so she's asking about
Over the counter. So we have a question. Is it the
Over-the-counter.
frame
If
that
it's-
we're talking about, or the
no, if it's
She
for
found
reading,
out that her left eye has a grade of 200 and 175 on the right.
If it's reading glasses,
Yeah,
then
yeah.
over-the-counters
It's
are
okay,
fine. Now, if she had problems with distance, then over-the-counter glasses will not really correct because it's different also. When you usually go over-the-counter, they're always going to be 50, 75, 100, 150. They're not going to be equal. So, yes, she'll be able to adjust. She can focus that little bit of a difference, but by the end of the day, she'll
Might
have
get tired.
headaches. She might have twitching of the eyes, namumula yung mata, nagluluha, because nag-eye strain siya.
It's
Because
more
one
of
eye
discomfort,
is,
yeah.
it's just discomfort more
but
than
I'd like to tell everyone that wearing a wrongly prescribed eyeglass won't destroy your
A
eyes.
self-prescribed
Yeah.
pair.
Sometimes, this is the reason why safe na safe mga optometrist eh. Hindi sila makakasira ng mata. Kasi kunyari, nagkamali sila ng sukat, hindi naman masisira yung eyes eh. The patient would just suffer from headaches and discomfort.
eye strain and eye
Eye
fatigue
strain, yeah,
will be the
fatigue,
most
yeah.
common problem.
And then the eye strain and eye fatigue, does it lead to something else? Or it just remains at eye strain and eye fatigue?
It ruins your day.
Yeah.
Okay.
It just you just
You won't be
you're
able
not
to work
comfortable.
well.
Like I had a patient just come in a while ago. He said, "Doc, I broke my old pair of glasses that I had made with you, and then now I had one made outside, and then I'm wearing it pero malabo. And then when you check it, mali kasi nagbaliktad yung pa. So hindi naman niya he doesn't notice because I can still see a little bit clear. It's not as clear.
Ayan na naman yung
Kasi
hindi, okay pa,
lang
I
yan
can still see.
So pero ngayon by noon after lunch he has a headache. his eyes are teary, he can't really drive well at night. And then that becomes a problem for him already. So he had to come back and we had to check, and then we have to have a new pair made. So it doesn't destroy his eyes, but yeah, like Dr. Laksamana said, it just ruins your day. It just makes everything...
But this one made Carol's day because she got surgery already. Maraming salamat, Carol, for sharing with us your story. Any tips dun sa mga nanonood sa atin who might have a similar problem?
Tips? Wala naman masyadong tip dyan eh. Doktora naman tip yan.
Tip, based on your experience lang, pag napansin mo na medyo malabo na or hindi ka na maka-function na normal, gaya ng ibang mo
Pag
mga
hindi ka na
kaibigan.
comfortable talaga, magpa-check up ka na lang para mas okay yung everyday living mo. Yun lang din
It's a
naman.
quality of life more than anything else. Whether you wear glasses, contact lenses, or do the surgery, it's how you want to live your life. If you're an active person, then you might as well have your laser done if you're doing a lot of sports. Now, if you're more of working in the office, using the computer, and you're not minding wearing glasses every day, then it's perfectly fine. Nobody's going to fault you with that. But it really depends on you. Contact lenses will also work as long as you're not lazy, right? And you don't
You're
sleep. Or you're responsible.
Yes.
We can give kids contact lenses as well, as long as they're responsible. It really depends on the individual, and it's how they want to live their life as well.
Thank you, Doctor. So I'd like to thank our guests for their valuable insights on how to take better care of our eyes. Thank you so much, Dr. Noel Laksamana and Dr. Carlos Chua. Maraming salamat there, Daryl. See you again next Tuesday on Medtalk, 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.